Viewers all over the world, wherever you are watching us from, this is UStv Africa. The program is Society in Focus, and our topic of discussion today is availability of health facility in Nigeria. And the point of call is Memorial Hospital here in Abuja. Before we proceed, it is worthy and important to let you know that Memorial Hospital is one of the #1 leading private hospitals in the world. They have their headquarters in Turkey, and recently they just established a branch in Nigeria. Health, they said, is wealth. But apart from health being wealth, health is one of the most important needs of a man. For a nation to grow, you will need a healthy economy. For a nation to progress, you will need a healthy security. This is to say that the importance of health to human beings cannot be overemphasized. But some of the problems facing humanity, particularly in the continent of Africa, are affordability, availability, and access to quality healthcare services. This is why the management of Memorial Hospital, #1 private hospital in Turkey, decided to establish a branch in Nigeria, the first in the sub-Saharan Africa. You agree with me that before now, a lot of Nigerians that are in need of critical health services would prefer to travel out of the country to enable them access to quality and advanced health facility. Travel no more. The same facility and quality of services that you travel to obtain out of the country is made available in Nigeria by Memorial Hospital. On the occasion of launching the Nigerian branch of the Memorial Hospital, Dr. Musa Omar, PhD, the African Regional Manager of the hospital, have this to say.
Distinguished guests, ladies and gentlemen, indeed, it is a honor to be with you here to opening our first representative office in Africa, Memorial Hospital Groups. As we mentioned earlier, Memorial Hospital is a private hospital, one of the best hospitals in Turkey, with 11 hospitals, 4 medical centers, and with 7,000 doctors. So thank you so much for attending and join us for this occasion. Thank you.
Also, on the occasion of the launching, the country administrator of Memorial Hospital, Dr. Zainab Bashir, gave detailed analysis of the modus operandi and the things that Nigerians should look forward to from the hospital. Listen to her and get detail of what she said.
Ladies and gentlemen, distinguished guests, esteemed partners, it is with great joy and pride that I stand before you today to celebrate the grand opening of our Nigerian office. I am even more happy because this is not just the inauguration of our Nigerian office only, but our first African office. This momentous occasion marks the unwavering commitment, dedication, and hard work of Memorial Hospitals Group to providing exceptional healthcare services to Nigerians, Africans, and the global South. As we gather here today, we are not merely inaugurating an administrative and liaison office of our prestigious organization, but we are, one, ushering in a new era of healthcare accessibility, which serves as a testament to our collective vision of saving lives and building a healthier and successful society. Two, we are establishing a direct connection between our doctors in Nigeria and their contemporaries who have access to modern technologies for healthcare delivery, which serves as a medium for knowledge sharing and partnerships. Three, committing to the goal of making Nigeria's healthcare industry the pinnacle of quality healthcare delivery in sub-Saharan Africa. Memorial Hospitals Group is a leading global healthcare provider focused on patient satisfaction to provide high-quality service by using international measurement methods and improved mechanisms to ensure that the world-class health services are provided to our patients. With 12 hospitals, more than 1,300 doctors, 7,500 employees, Memorial is one of the largest hospitals in Turkey. It is also the first private hospital in Turkey and also the first hospital with the JCI accreditation. We are a well-known institution in and outside Turkey. Memorial Hospital is also one of the leading healthcare companies in the Middle East, Africa, and Eastern Europe. Around 1,000 international patients from over 164 countries receive medical treatment in our hospital annually. We are not only a reference center in Turkey, we are also a reference center in the whole world. The establishment of our Nigerian and First African office is undoubtedly a significant step to strengthening the relationship between our hospital and our patients in Nigeria and by extension Africa. It also marks a significant milestone in our drive towards enhancing healthcare accessibility in Nigeria. Today marks a new chapter in our journey, a chapter filled with endless possibilities, boundless opportunities to make a difference. A great difference in oncology, neurosurgery, urology, organ transplant, and other health challenges that have posed a threat to our teeming population wherein we cannot surmount. Our goals are both short term and long term, and they include making quality healthcare accessible to people, which cannot be overemphasized, creating an opportunity where hope is not lost for medical conditions that cannot be handled here in Nigeria. And what I meant by that, I'm not saying, okay, Nigerian doctors are not good. No, I'm a doctor myself. I know that we are trying our best, but there are cases that are beyond us at the moment. Just like I've mentioned, oncology, most bone marrow transplants cannot be handled here in Nigeria. Also, our goal here is also to save lives and to use the opportunity to facilitate sharing knowledge for our doctors, knowledge sharing for our doctors. Host OPDs regularly, which are committed to bringing, we are committed to bringing our doctors into the country monthly or bi-monthly. And this is for one, free medical consultations and second opinions, training of our doctors, introduce cut-edge technological medical practice, corporate social responsibilities such as OPDs across the country, free distributions of medication to less privileged Nigerians, health advocacies and campaigns, health summits and workshops, and also support the government. We are not ignorant of the challenge that lies ahead. We believe we can provide a world-class medical service to our patients with our experienced surgical team, staff, and support services. We are confident that our shared goal and excellence and quality healthcare delivery will guide us through any adversity. As we open our doors to the community, let us reaffirm our pledge to serve with compassion, to innovate with purpose, and to always put the needs of our patient first. With a great reverence for the sacred trust that has been bestowed upon us, we will strive to work beyond expectations. In closing, I extend my deepest gratitude to each and every one of you for joining us today on this momentous occasion as we embark on this great journey. Thank you, and please do have a wonderful evening.
That is Dr. Zainab Bashir, the country administrator of Memorial Hospital, Nigeria. Before we proceed, there are some basic things that you, as an individual, need to know about the Memorial Hospital in Nigeria. One, it is important for you to know that the hospital is located on Suite 314, GCL Plaza, number 2, Gemina Crescent, off Aminu Kano Crescent, Wuse 2, Abuja. Apart from visiting the hospital in person, you can also reach them online for any of their services via www.memorialhospitalsgroup.com. It is equally important that you know their hours of operation. From Monday till Friday, they open and operate from 8 a.m. up to 5 p.m. On Saturdays, they open and operate from 9 a.m. up to 2 p.m. And on Sundays, they don't operate on Sundays. Having heard all this is an opportunity for you to have access to an affordable, advanced, and accessible health facility in Nigeria. The same that you will have traveled to Turkey, Germany, India, or America to obtain is right here at your doorstep in Nigeria, courtesy of Memorial Hospital. The program for the launching of the Nigerian branch of the Memorial Hospital was brought to an end by an elder statesman, Ambassador Munir Y. Liman. Ambassador.
Okay. أعوذ بالله السميع العليم من الشيطان الرجيم. بسم الله الرحمن الرحيم. Although I didn't come here to make a speech, but I was asked to come and say a closing remarks. Actually, my appreciation goes to the management of the Turkish Hospital, Memorial Hospital, for keeping it a date to come to the capital of Abuja to open a branch. Even though we have not seen the details of the branch office, what they are going to do, but our assumption is that this office in Abuja will be a starting point. If a patient is interested to go to Memorial Hospital in Turkey, he will have his diagnosis to start right from this office. From here, they will establish the fact that if there is a need for him to go to Turkey or he will remain in Nigeria to be treated. This is a very good development and is commendable. We are looking forward to see the boost in economic activities between Nigeria and Turkey. More importantly, we are living in a global world. Everywhere you go, you find that there are certain developments which you don't have to be there physically. I know the Memorial Hospital. I visited the hospital twice in Turkey. They have all the necessary facilities and equipment. They may even start treating patient right from there while the patient is here in Nigeria. So it is important we take note of this because I know the facilities, I know their capacities, and I visited the place. They have a very sound and well-maintained facilities. So we thank you very much for opening this branch in Nigeria, and we urge you, the people that the guests that have been here to grace this occasion, to come and patronize this hospital. We thank you very much for attendance, and we pray Allah subhanahu wa ta'ala to take you back to your respective destinations safely and happily. Assalamu alaikum wa rahmatullahi.
My name is Onechojon from the station of UStv Africa. Thank you for being with us. Hope to see you again on another interesting edition of the program Society in Focus.